Hormones. Cholesterol, progesterone equals estrogen. Corpus luteum is main site of progesterone produced in a woman's body. It's made when women ovulate. 200 to 500 million sperm are released with one ejaculation. Sperm is the smallest cell in human body. Women's monthly hormone balance are important for welcoming sperm and conceiving. Wait 4 weeks before sexual intercourse to heal a pap smear before sperm enters. The pill is a synthetic progesterone and estrogen. Causes massive cell growth in ovaries, massive cell growth in the uterus, causing too much endometrium to grow. Estrogen can proliferate and cause cell growth in breast and weight gain in torso and opposes high thyroid function. Growth stimulants are found in meats and fish products. Plastic, a nonylphenol, unlocks the ring that gets into the estrogen cell. Plasticide chemicals, xenoestrogen, is 20,000 times larger than a human cell. Careful for GMO Roundup on soybean. Red clover is a plant estrogen that will be good to have in a body as first option for body to use waiting in the receptor. Also use BPA plastic-free products. How to balance the body. Eliminating the pill. Monitoring when you're ovulating. The temperature will change. It will drop and then go hotter on a higher plane, indicating ovulation around day 14. Vagina mucus will change when estrogen is high. It will be white, stringy, and more scented. Cervix will change too. Learn your body's flow and it will determine when to wait this week or use a condom. Detoxify excess estrogen. Hydroxy 2 pathway, safe, and hydroxy 16 is unsafe. Vitamins B6, 9, and 12 stimulate H2 and eliminate H16. Raw nuts and seeds, cabbage family, contain indoles that encourage hydroxy 2, as well as licorice and flaxseed. Anna's wild yam cream, when applied to the skin, fat cells stimulate the body to increase the progesterone production. It's a hormone modulator. Apply with fingertip, rub on your neck, to the inside of the arms, then the chest, abs, and thigh, the tender parts, alternating different areas. Apply morning and night for 3 weeks to a month. Stop for a week of menstruation. Stay on the Anna's cream for at least a year at any age once menstruating, and is used for premenstrual tension, painful periods, heavy periods, ovarian cysts, fibroids in the uterus, thyroid, depression, and breast cancer. For men, apply once a day with no break. Use for penile dysfunction, low sperm count, and help control prostate. It helps absorb osteoporosis, boost progesterone, and boost osteocells, the bone-building cells. Menopause. Women have no lubricant and tender cells. Yoni stones, nephrite jade, that comes in 3 sizes, can be inserted into the birth canal up into the cervix, where the largest first, an hour a day for a week, second week, 2 hours a day, third week, 3 hours a day, fourth week, 4 hours a day, 5 weeks, and on. Wear for 5 months, 5 hours a day. Your pelvic girdle gets very strong, and after 5 months, wearing the larger, then move to the middle size, then wear for 5 months for 5 hours a day, strengthening the muscles against it, then move to a smaller for a few months. Muscles know no age. This strengthens the muscles and it creates blood to the area that feeds the glands that produces the lubricant. Lining of the birth canal is no longer tender. It repairs uterine prolapse and lower back problems. Squats. Do squats every day. It strengthens the pelvic girdle. Drink water, exercise, eat a plant-based diet, and sleep well. Issues of protein. The human body is made of protein in form of muscles and structural components that hold much of the body together. Protein provides the structure for nerves, blood vessels, organs, skin, hair, nails, and hormones. The enzymes that facilitate chemical reaction of digestion and hormonal regulation, or special proteins in our bodies, contain 100,000 kinds of proteins. We do not store proteins as we store fat. Protein is constantly being broken down into amino acids. To replenish the supply and rebuild what breaks down, we must eat protein every day. Of the 20 amino acids, 10 are considered essential because our bodies cannot make them. When we eat food containing protein, our body breaks it down into individual amino acids, putting the amino acids back together in a special way to form the specific protein needs. Foods are complete or incomplete sources of protein. Complete proteins contain all the amino acids, while incomplete proteins do not. Meat, including poultry and fish, eggs, and dairy, are complete protein sources. Seeds, such as beans, grains, and nuts, are considered incomplete protein sources. A severe lack can lead to serious protein deficiency, and symptoms of this include wasting away of body tissues, weakness and fatigue, impaired growth in children, fatty liver, and weakened immune system. Quality complete protein is essential in a nutritious diet. Meats as well as dairy are excellent sources of complete proteins, but it is important to choose pasteurized meats. The endocannabinoid system is an ancient biological signaling network that regulates numerous physiological processes, including intestinal function, glucose metabolism, and the stress response. A dysregulated endocannabinoid system is implicated in metabolic and bowel pathologies and many other diseases. Roles of the cannabinoid receptors, CB1 and CB2, pertain to diet, digestion, and energy metabolism. CB1 receptors are concentrated in the brain and the central nervous system, the gut-brain axis. THC is cannabis's main psychoactive component. It boosts appetite and food intake by binding to the CB1 receptors, facilitating essential nourishment as well as metabolic imbalances. CB1 receptor signaling triggers a newborn suckling instinct. Mother's milk is well endowed with arachidonic acid, a basic building block of the brain's own cannabis-like compounds. Anandamide. These endogenous cannabinoid compounds bind to the same cell receptors, CB1 and CB2, that mediate many of the effects of cannabis. It's found in eggs, meat, and dairy products. Arachidonic acid intakes increase endocannabinoid levels in different tissues and is crucial for pre- and postnatal brain development. In addition to highlighting one's sense of smell and stimulating appetite, CB1 receptor signaling restores its homeostasis, suppressing negative memories, stress and trauma, and reducing anxiety at the level of the central nervous system. CB1 receptor activation is associated with increased energy intake and decreased energy expenditure by controlling neural pathways. The endocannabinoid system is deeply implicated in the unhealthy world trajectory from diet-induced glucose toxicity to excess sugar intake. In obese humans, high endocannabinoid levels are found in the liver, pancreas, adipose fatty tissues, and skeletal muscles, where they contribute to insulin resistance, decreased glucose uptake, oxygen depletion, and cardiometabolic distress. CB2 receptors have an inflammatory effect, primarily in immune cells, fatty tissues, and the peripheral nervous system. CB2 signaling is also protective against brain damage from strokes, concussions, and neurodegenerative ailments. Dietary secondary metabolites from vegetables and spices are able to enhance the activity of CB2 receptors and may provide adaptive metabolic advantages and counteract inflammation. They can stimulate insulin production and inhibit tumor growth in human cell lines and mitigate non-alcohol fatty liver tissue disease through the CB2 mediated channels. Healthy fat supports neurological function, retinal development, and overall health by upregulating CB1 receptor gene expression, prevents glucose intolerance and inflammation of white adipose tissues in obesity. Benefits of omega-3 EFAs prominent in oily fish, walnuts, flax, and hemp seeds include the prevention of heart disease, dementia, cancer cell proliferation, insulin resistance, and depression. Alzheimer's sufferers and children with attention deficit hyperactive disorder tend to be deficient in omega 3 fatty acids. A healthy balance of omega 3 fatty acids and grain derived omega 6 fatty acids is fundamental for preventing and maintaining obesity and metabolic syndrome. Altering the ratio from omega 6 to 3 to omega 3 to 6 improves treatment regimes for anxiety and PTSD, as well as for metabolic disorders. The key to healing success is to boost white blood cells. Overall problems can happen with too many or not enough. Humans are always full of healing potential. Conventional medicine can be helpful in illnesses and disease, but is absolutely not equipped to help maximize health and wellness. Each human has full and complete control for maximizing health. The current medical model is set up to test and report the outcome of medical or surgery intervention outlined in the scientific literature. Then these statistics are used as the standard of care. Results collected from a study states the outcome for your particular group at that particular point in time, the location, and what the particular modality. Your doctor reads this and sees patient in office, and if diagnosed with an illness, the doctor reviews the current standard of practice for the disease based on these studies, suggesting medicine or have procedure done. Doctors and only limit your healing potential with what has been the most probable in the past for others. Many times these statistics are frightening and deflating. This can change the outlook of the patient for the worse, bringing the patient down without revealing the unlimited healing potential of our body. You have unlimited healing potential. You should know that. Every cell in our body has unlimited potential to heal what we do in modern medicine. These experiences of people getting the illness that you have and surviving and thriving, fully healing from it, are proof of what is possible. There are unlimited ways to heal, and there are many paths to healing, and you can align with any one of them, or many of them. The process of healing should be uplifting and a relief, not a battlefield. Keep mind and heart open to possibility by actively choosing inspired action of what is possible in healing. Lay out possible paths back to well-being and together reach for that. If physicians looked through medical literature filled with all kinds of beautiful outcomes from all kinds of amazing interventions and treatments, both holistic and conventional, then from this information together, come up with a treatment plan that feels right to the specific patient. This method is very useful guidance, and we should absolutely be including it in our decision-making process. There are unlimited ways to heal. That is what healthcare should be, a journey back to wellness. Visiting the doctor should be a wonderful, uplifting experience. Ideally, patients leave from every doctor appointment feeling full of possibilities, a chance to get all kinds of healing possibilities, inspirations, and ideas collected from the medical literature from all over the world, offered to patients by someone who is a healing advocate. When physicians talk to you about a treatment plan and gives you outcome percentages and probabilities, just remember this is simply a mass marketed number. It doesn't tell you what is possible with this condition, and it doesn't tell you what is possible for you. There is a path unfolding for you and leading you right towards wholeness, healing, and well-being. A beautiful and exciting truth. Healthy is profoundly simple. Our bodies are engineered to be healing machines. All you need to do is follow your intuition. The 10 most powerful natural antibiotics known to mankind have saved countless lives, turning serious and life-threatening infections into temporary ones. However, with the billions of prescriptions for antibiotic drugs that doctors have filled out over the years, there comes a serious price. Microorganisms adapting to our techniques. We now have what is called superbugs. The problem of superbugs is they don't respond to regular prescriptions of medical antibiotics. In fact, they are resistant to them by our methods for killing off wanted bacteria that developed. Their methods for fighting back grew stronger, so today we need to take serious measures to deal with the problems of antibiotic resistance so that we can once again gain the upper hand against microorganisms. Many people are now turning to natural antibiotics to fight milder infections and so limit the pavilions of antibiotic resistant bugs. To do this properly, however, it is important to understand what type of antibiotics there are and what they actually do. So, choosing a natural antibiotic can fight bacteria or fungal and some parasites, but not viruses. That's why doctors won't prescribe you antibiotics for a viral infection or the flu in the same way you shouldn't attempt to use natural antibiotics to fight a virus. They simply won't do anything. Natural antibiotics can be further divided into antibacterials and antifungals. While medicinal antibiotics are usually designed to do both, nature's variety usually has pretty specific functions. So, natural antibiotics are apple cider or kombucha vinegar, ginger, onion, horseradish root, habanero pepper, turmeric, garlic, raw honey, and oregano essential oil. Natural antifungal are echinacea root, apple cider or kombucha vinegar, oregano, ginger, turmeric, and raw honey.